Okay, so for this video, what we're going to be doing is we're going to be thinking about ankle mobility. It's an important part of movement, walking, squatting, especially if you have balance issues and or issues with your knee, if you have knee pain. So with those bending, squatting motions, especially under load, if the ankle doesn't have any give, it's going to go right up into the next available joint, which will be your knee, and potentially overload, overstress, overstrain. So I'm going to put my foot up on this step. You can use stairs at home, especially if you have railings. If you have balance issues, probably a good idea. If you don't have those things, you can have a step stool like this. You're going to want to have a wall or a counter next to you, maybe a counter next to you and a wall, or back of a sturdy chair and a wall, so you have something to hold on to, or a walker or a cane or something. We're not actually stepping up onto the step here. This is just a simple rocking forward of my weight. I'm trying to almost go into a bit of a lunge. I still want to be cognizant of trying to rotate, and through my pelvis, I'm twisting back into my buttock here to get my knee to come into alignment with like my fourth toe, somewhere in there, fourth, fifth toe. And then I'm gonna stabilize on the inside here as I ground through the big toe knuckle. So basically I wanna get my weight that I'm able to push through here, which will not be full body weight, through the arch of my foot. I do not wanna be in my toes. I definitely don't wanna be lifting my front heel here. I want to keep grounding that to keep my weight through the arch and not all into my knee and my toes. So I'm still pulling back and grounding there, even though I'm kind of lunging forward, because I'm trying to leverage right into my ankle. So right in the crease in the front, there's a bone that sits back in there, the talus bone. And that bone needs to be able to stay back and down as the tibia, your shin bone, kind of rolls over top. And so what that does is it creates a little bit of a glide back through as your tibia rolls over. That way you don't just keep rolling. But we don't often, it's very uncommon to actually dislocate your ankle like that. So what ends up happening when it does move is there's a glide to keep everything in place, because you have ligaments and other structures to keep everything together. But what more commonly happens when you have a problem is it just stops, it just jams. So you got to get that bone out of the crease so that it can bend. And to do that, you got to pull back and ground that heel and anchor that foot and try to get a stretch in through the calf area, the lower calf. There's a muscle there known as the soleus. It's a great stabilizer, but sometimes it's overly tight along with some of the other muscles that run on the inside, outside there. So you just want to make sure that can give back there and that you can take that up and guide that crease to an increase. You want to increase the crease there, and you want to stretch and open up back there without creating too much knee pain, and just leveraging and directing as you steer through. So there's a lot of little things to kind of put together, but the simple aspect of this is just to kind of rock through without creating too much knee pain and trying to get that bend and that stretch. So in this position, we're not putting full weight here. I've got most of my load remains in my back foot, which I can lift that back heel up if I need to. I'm just not stepping up. I can do that also on level ground. The thing here is you just got to get down a little lower. I can do that with wall support and kind of coming in here, and that way my foot especially is up against the wall or close to it. My knee won't be able to go too far past, but I do want to have that nice mobility through that ankle, so when you walk, you can get a nice roll and allow the knee to bend without too much pain, especially if you're going up and down stairs, that kind of thing. You want to have a good amount of bend, or squatting. You want to have those knees be able to go forward without jamming up and creating pain. You need that ankle mobility.